Good evening. What's up, Naki?
What's up, Carl?
It's another evening of Koviki talk with people with amazing bios. I was looking at the bios and they
Mhm.
seem to just be getting more amazing as we go along.
Right.
So, welcome everybody to Koviki Talk. Koviki Talk is a multi episode series where we talk about all things COVID 19, but from the PI perspective. So, we speak to our community through people who look like us and talk like us and live like us. So, this week, we're continuing up the coast of California. We started way down south with San Diego, then we moved up into Southern California, went out into the desert last week with the Inland Empire, and now we're in Northern California. So let's welcome our panelists from Northern California, and then we're gonna get into some all the amazing things that Northern California is doing. And it's a little bit extra for Naki and I because we're in Northern California. So we work shoulder to shoulder with a lot of the people here, especially the people on the panel today. So I'm just going to start in. I'm going to introduce Ruth Talāmoa, aka Ruthie. She's a Bay Area native from East Palo Alto, California, born and raised. She attended California State University East Bay, where she received her BA in psychology and BS in biology with a concentration in physiology. She is a health navigator for the Pacific Islander Wellness Initiative in Alameda County, in which she does outreach to the Pacific Islander communities with mental health, co-facilitates psychoeducation and Talāmoa for wellness, and provides resources to those in need. Welcome, Ruthie.
Thanks for having me, Carl and Aggie. Appreciate it.
Thank you. Next, we have Luci Latu, who's first generation Tongan American residing in the San Francisco Bay Area. She's been the project manager for Talāmoa since 2007, and coincidentally been working for the County of San Mateo since 2007 also. For the last 8 years, she has been at the San Mateo Medical Center, the county hospital, working at the Innovative Care Clinic, Adult Primary Care Clinic, as well as providing support where she is needed with our pediatric clinic and Ron Robinson Senior Care Center. She is grateful for the work she does with Talāmoa as a community-based nonprofit organization and with the San Mateo Medical Center because she is afforded the opportunity to serve the underserved and inappropriately served members of her community. She gets to be of service for others, which she finds to be the most fulfilling, humbling, and rewarding work to experience. Welcome, Luci.
Hi, I'm always muting myself. I always forget how to unmute.
You're fine.
Thank you.
The mute button found a special place in everybody's heart in 2020. Everybody got used to the mute button. Next, we have Keikoa Lopez-Paguyo. Kekoa is a native Hawaiian from Kalihi on the island of Oahu. We have that in common. We both used to live in Kalihi. Koa graduated with his master's in public health from UC Berkeley and has been focused on Pacific Islander public health initiatives since graduating during the pandemic. Right now, he serves our community in outreach about free COVID-19 testing, healthy food box drives, and vaccine navigation, as well as resource coordination for positive COVID-19 cases and contact in Alameda County who may need delivery of food or cleaning supplies to successfully isolate or quarantine. Koa is interested in public health advocacy for better PI race disaggregation and COVID-19 surveillance locally in the Bay Area and in vaccine administration, as well as making sure that there are better links between case investigation, contact tracing, and vaccine supports in Alameda County. Welcome, Kekoa.
Thank you for having me. So happy to be here with all these esteemed guests.
Awesome. Next, we have Tino Felise. Tino is a program manager at the Samoan Community Development Center. He has worked in the Pacific Islander community for over 12 years, providing services to family, youth, and elders in San Francisco and the Greater Bay Area. He is a strong advocate for the Pacific Islander community in San Francisco, making sure they are receiving the necessary services they need, and has helped build partnership throughout San Francisco and the neighborhoods that our Pacific Islander community resides resides in. To further support his community, Tino is currently pursuing his education in psychology and one day hopes to become a family therapist. Since the start of COVID-19 pandemic, Tino has played a huge role in SCDC's COVID-19 efforts, creating a COVID-19 team for our Pacific Islander community to provide culturally relevant services within the community. Through SCDC and the neighborhood partners, Pacific Islanders and other communities alike are able to receive COVID-19 testing, care packages delivered to the families and community members, personal protection equipment, PPE supplies, groceries, and additional support around COVID-19, contact tracing, as well as case management for the families that are impacted by COVID-19. This partnership created a way for our Pacific Islander community to learn about vaccination and also support families and elders with scheduling appointments to get vaccinated. Welcome, Tino.
Thank you, Antonaki. Thank you, Carl. Thank you, probably by design, just opening this great space and just continue this conversation. Thank you all.
Good to have you, Tino. I think Naki and Tino are partnered at the hip today. They left one meeting together and then came here for Koviki Talk together. So good to have everybody here. So we've asked a couple different questions in San Diego. I think we asked what were the panelists' favorite things about San Diego. But I'm going to ask a different question for the Bay Area. The stimulus checks are on the way. They're on the way to the accounts. What are you going to do with your stimulus check? And if nothing, I've learned through our journey through Koviki Talk is do not throw a question out to the panel and don't say a name, because everybody's humble and everybody waits for everybody else to go. And there's this long drawn out silence where everybody waits for somebody else to talk. So I'm going to start with Keikoa. If and when or you get the stimulus check, what are you going to do?
Oh, wow. That's a big question. I haven't really thought too much about it. I know that the 1,400 stimulus checks are kind of like on their way. But I think I'm probably just going to whack it in my savings account and then just hopefully maybe think about paying off some of the principal on my student loans, maybe something like that. Not too exciting here.
Yeah, it's kind of interesting to see on social media that everybody's joking about it. Like I saw a post where it showed all the noodles in the grocery store and all the shelves were fully stacked. And the joke was, oh, you're too good for noodles now. You're getting money. So Ruth, how about you? Any plans if and when it comes?
If I get it, because I still didn't get the second one, but if I were to get it, just to catch up on bills.
Yeah, I think that's after all the fun there is on social media with it, I think that everybody's just doing the right, doing things that matter. Luci, how about you?
I'm going to save it for a vacation, and this time it's a real vacation, not a go to some destination where I have family that end up being more work than actual vacation. I'm going to be like a palangi and take a vacation.
There you go. Good for you.
There you go. You can have a COVID vacation and enjoy it. Call it a COVID vacation when you can actually travel instead of, we all laugh about staycations before 2020. Like, I'm just going to stay at home. We all stayed at home at 2020. So all of our vacations were probably that way. Tino, how about you?
Thank you. I think I'm going to just piggyback off what everybody said. I'm going to do a little savings like Kekoa. I'm going to pay some bills off like Sister Ruth and Sister Luci. Try to plan a vacation for the family. So yeah, I think that's what I do with the stimulus. And yeah, so hopefully everybody doesn't squander it all on one thing.
All right. Well, we got a lot of ground to cover today. There is a ton of information and resources that we want to get out to the viewers and the public. So I don't, usually we kind of chat it up a little bit, but I kind of want to dive in and make sure that we cover the ground that we need to cover. So I think we'll start with Keikoa and let him kind of talk about what's going on in his neck of the woods, what his focus is, and the priorities that his organization is focusing on.
Yeah, thank you, Carl. Yeah, I represent the Regional Pacific Islander Task Force. We kind of don't see our work kind of grounded in one county. We kind of represent all the counties here in the Bay Area. And then lately, I've been trying to really retool all my resource navigation skills for really vaccine navigation. So I've helped sort of set up the groundworks for spreadsheets to sort of track all of the folks that we were kind of directing to community partners to get vaccinated. And then, sitting on a lot of different meetings with county folks and training us to direct people to their county run pods to get a vaccination. And that, yeah, just I guess staying up to date with all the changes. They're kind of like daily changes even today with new eligibility being added. And just staying in track with how, the documentation required that we need to make sure our folks have, and all the types of access related issues that do come up, to keep those in mind too. Whenever we do send people there, we don't want them to get turned away. So, because that would hurt everything that we're trying to do. They might never, go back for their vaccination if they get turned away. It's such a bad experience for them. So yeah, just making sure that, our people have everything they need to get to their appointment, not even just their appointment itself, but also like all the documents involved, transportation, or just like acknowledging when they need more accessible vaccination too. So making sure that there's linkages for that too. If there's somebody who's disabled or has physical mobility issues and that kind of thing. But I'll stop there. That's a lot of information. Maybe I'll toss it over to my fellow panelists here to.
Kekoa, what are the priorities for your location and your team there? Is it vaccination, or has it changed? Because before it was getting everyone COVID testing, then getting them what they need. Has it turned to vaccination?
Yeah, I feel like kind of full force, ever since March started, even kind of at the tail end of February, it's like we started transitioning to thinking more about vaccination, since that's the more preventive approach for everything, really helping our people with the most preventive, protective thing that they could use. So I think that, yeah, we've definitely kind of switched focus. I'm not alone. Like I have Ruth here from PEV who could speak to that too.
Ruthie, what's going on, girl?
Well, with the Pacific Islander Wellness Initiative here in Alameda County, and we are based in Hayward, but we do serve the whole Alameda County. And so working under Nat and Tal, they're also part of the regional PI task force. And so I was asked to come on board, since our priority right now for our people is the vaccination. And so I've been working along Kekoa, attending the trainings as well, because they're different community partners on different vaccination locations, and they ask for different things. And then so just sitting alongside with Koa and staying on the line. So when the folks that we do sign up for these vaccines, if there are any trouble that they have when they go to the site, we're there to answer their call and communicating with the higher ups there at those locations that we send them to. And so we also at PEV, we're still working and focusing on mental health. And right now, I'm a co-facilitator with Kevin Niuatoa. We're working with Hayward School District right now, speaking to the students as well as the parents. And so we're still running our Talāmoa for wellness. And those are some of the things that we're doing. But right now, the main focus is the vaccination and getting our folks access to that.
And is the Hayward School District, or is it completely open, or is it slowly opening up?
No, they're still closed. So everything that we're doing is through Zoom still.
Oh, Zoom. Okay. Awesome. Luci?
You hear me now? Okay.
Yes.
So I'm at San Mateo Medical Center and at San Mateo County, and the focus has been vaccinations and just trying to find the best way of, because we have our own, the medical center has its own population that we're responsible for providing vaccines for, aside from distribution of the vaccines to the smaller providers in the county. It's a challenge having to split attention and making sure that the patient population that we are responsible for are also getting vaccinations, and maintaining the guidelines that the CDC has set for us. So the vaccinations are definitely a priority, but also continued outreach and education, that even though you get the vaccine, doesn't mean that you get to not wear a mask and not, still follow the guidelines. It's also making sure that people understand the testing. And for those that have, just if they were positive COVID, then they get the vaccine. There's like a window time frame of when they shouldn't have the vaccine, or some will, there's just so many different exceptions. And then now that the new tier the new phase has opened up effective today, which is 1C, that's added another layer of fun for us to try to figure out how to get to those people also, because that's a larger population of people that we would need to vaccinate also.
Tino, what about you?
San Francisco, for Samoan Community Development Center, we have actually been involved with DPH in meetings like learning communities when the COVID hit, just joining some of those meetings and ensuring that SFDPH does their due diligence in passing out the information to all the communities that are involved with the support with COVID testing. Also sitting on SFDPH vaccinations meetings, making sure we're ensuring that our Pacific Islander folks are not being overlooked, but also too, like we share, even though we're a small population in this city, we make up a lot of the main categories within like SFUSD within the city. So we just want to make sure that we're not overlooked. And that's also sitting on meetings with UCSF with some of the folks. We have a meeting called People of Color, led by another strong female doctor, Dr. Kim Rose, who is African-American, actually been leading the charge for vaccinations, making sure that it is equitable across the board for all our communities that we're serving in San Francisco. Like you said before, the main focus was COVID testing, and it still is COVID testing because some of our folks in San Francisco are still a little unsure about getting the vaccination. So we want to make sure that they do still have the option to get tested to make sure that they're staying safe around their loved ones. So both are still a focus of concern for both COVID testing and vaccinations. And it's just the vaccination and COVID testing, just a great partnership within the community that SFDPH entrusted some of the community folks in the neighborhoods to serve our own people, because our people would like to see people like us at those different sites, make them comfortable, but also too having the right translations. And also, like Brother Kekoa said, some folks, they'll go to a site and they don't see nobody that they know or people like them, they'll just drive off. So we want to, kind of cut that out and make sure that we're at the sites that we need to be at throughout the city to make sure our community is served, and also to support it in a way where, they're not getting turned away, how we've seen some of the challenges in the past. And also too, just a big shout out to Face SF is another neighborhood community organization in Sunnydale, and J&J's, and then the Bayview Child Health Center Clinic that's actually that are doing the vaccinations for us. We're part of the COVID testing team, and then Bayview Child Health Clinic, our health center, is actually part of the vaccination side. So we have two components going on, and we actually coordinate Monday through Thursday. So we have 3 different sites, but 4 days that we're doing testing, and then 2 days we're doing vaccinations. We would like to get to a place where, all our people can come just to us and get vaccinated. Don't matter what zip code you're in, don't matter what city you live in, or even where you work at too. We're just trying to make sure that it's available, and our community, if they need it, we want to make sure that they can get it. And also too, with no questions, no jumping over obstacles or any other challenges that they may be faced with, what we experienced with vaccination. So I think for us, there are 2 focuses, again, COVID testing and vaccinations. But I think, good thing is people are coming out to get vaccinated. Our PI people, I'm seeing them in the lines and getting vaccinated. So that's a good thing. I know there's a lot more of us out there, but, as the message is getting put out there, even talks like this, Koviki talk, just to get share our information out, that they feel a little more comfortable coming to these sites, especially the sites that we're at and that we're managing too. So, that's some of the other efforts. And also too, with just the hiring of a COVID team at SCDC is actually beneficial, because now, just saying community work is a lot, but then when you pile on another component to it, so we figured out, let's actually try to hire on another 4 more staff persons. You know, just the blessing of the partnerships that we have, and also too our Fatonu Tito just leading the way and continue to build us up, to continue to build these partnerships and bridges to help support our people. You know, so I think just with that, like, you know, having a CICT person on hand and also 2 case managers to help support the efforts within the COVID and vaccinations is really, really a blessing. And also too, just seeing the great work that they're doing with all the other organizations. So you got, you know, Samoans, you got Ulis working together, and Asian API, but just seeing all of us work together, I think showing the community that, you know, we're buying into it, you should buy into it too, and also to the just relationships that we have with one another within the community that, like, you know, what I call them our champions in the community. So they're always advocating for us, but also we're advocating for them too. So then that's the great thing, I think, for the community side of what Samoan Community Development Center is doing for us, and SVPH and all these other partnerships throughout the city is really making sure that we continue to be sustainable, but also too, just making sure that all our communities are supported. So that's some of the efforts that we're doing here at SCDC. I know we'll talk a little bit more about it with our slides. So just want to say thank you.
I don't think people realize how important it is for people to see our faces at these vaccination places, COVID-19 testing, only because we're unsure, right? And we get elders there that have a lot of questions. And if they don't see people that look like us standing in line or there to help questions, like 80% of the time, they're going to walk away or, you know, come back or ask somebody else. So I'm so grateful to have you guys at these sites so that we're helping, and not just our community, but everyone, you know, everyone. So thank you for that. We have a question in the Q&A from Bobby Dalton Roy. How are you overcoming any vaccine hesitancy? Has your strategy changed now that the Johnson & Johnson vaccine has been added or has come out?
I could take that. In terms of vaccine hesitancy, like the only things I've been getting is just people who had questions about, you know, the side effects and the safety around the side effects. So I had like one person who was scheduled already for her appointment, but she just wanted extra clarity before she actually went to her appointment. So I was able to send her a graphic I co-developed for the Regional Pacific Islander Task Force with a couple of clinicians that I also know and respect and work with, so that they help me sort of have this clinical view on it, but also trying to make that reading level, you know, somewhat understandable for the public, essentially. So, you know, I sent that to her, and then she went to her appointment, and that was handled right then and there. But something I also kind of want to bring up about vaccine hesitancy, and it's something that I heard from Dr. Kim Rhodes, actually, who Tino brought up a little bit earlier, and it's that we should try to abandon that term a little bit. And I say that, you know, and I'll kind of qualify it a little bit, but she said that it seems like pretext for explaining disparities in our vaccine access. That, you know, if we're focusing on our hesitancy, it seems as if we're almost blaming our Pacific Islanders for not having the proper health promoting behaviors that we would like to see, such as adoption of a COVID-19 vaccine. You know, so rather than focus on that sort of deficit model, we should try to turn attention more so to like vaccine knowledge acquisition, so that we're more so focused on the positive end and actually changing mindsets and motivations to get a vaccine rather than focusing on what we lack.
Right. Another question from Bobby is, you indicated you represent not just one county, but all the counties in the Bay Area. How many counties are there that you include, and what are they?
Is that a question for me?
Yeah.
Okay, sorry. Yeah, the Bay Area Regional Pacific Islander Task Force, we sort of represent all 10 Bay Area counties. So going up towards like Napa and Sonoma, but also down to Santa Clara, San Mateo too. I think there's 10 total, but of course we have like 5 or so that are more kind of closely linked to our work. And are more so, you know, stronger champions for data disaggregation and that sort of thing. With regards to COVID-19 surveillance. So yeah, really all Bay Area counties, but it's kind of good to kind of keep in mind who's doing the work well. So we could kind of hopefully teach the other counties to like use their model and then try to not reinvent the wheel so many times, but also just kind of share knowledge across the county. So I think it's been helpful to kind of have that model of working county to county.
Awesome. Luci, are you getting a lot? Do you see a lot of PIs coming to get vaccinated, or do you have access to that data to see that information?
Yes, we do. It's just still being, disaggregated, but I have seen and a lot of the Pacific Islanders who've actually wanted to get vaccinated because they were part of the first group. As far as being, majority of our Pacific Islanders around here are caregivers, and it's not foreign to them to understand why they need to get the vaccine, and it's also to reassure their clients, right, and work to make sure that they're keeping their clients safe and that they're able to go to work because our work ethic is like really high up there. We will go to work every day of the week if needed, and COVID of course will hinder that, but they were knocking on our doors and on calling wanting to get the vaccine right away. And there are people that are explain side effects or the symptoms that one may get from the vaccine. It tends to amplify the anxiety that many would have around getting the vaccine. And I'll be honest, I did not want to get the vaccine. I didn't want to be part of the 1.0 version. I wanted to be 5.0. But I live in a household that has very high risk family. My dad, he gets dialysis, and my aunt, and they're older too. They're over 65. So thank God that I hadn't contracted COVID, knowing that I have been working this whole time throughout this whole pandemic, picking up shifts, and I never, that I'm aware of, contracted and brought it home. So when the vaccine was offered to me, not even that I was asking for it, but it was offered, I had to do a lot of deep soul searching, spiritual, reaching out to make sure that it was the right decision. But as Pacific Islanders, we've grown up where it's not about the individual, but it's about the whole unit. And I may have been born in America, but I'm very much a Pacific Islander, like deeply rooted in the culture. And I knew that if I didn't get the vaccine, being offered it, and if I contracted it, brought it home, and heaven forbid something happened to one of my family members, I would never be able to forgive myself. Right. And everything that I had done, and with as far as education and trying to get people to test or to, maintain the guidelines, would have all been done in vain if I had, gone against everything that I was trying to tell people to do. But the one thing that for the people that are unsure, because it is, it was an emergency approval, and the data, there's still more data collecting that needs to be done. But I told them that if we are truly a God-fearing people, that God gave us doctors, they gave us scientists, they gave us this vaccine. And if we believe what we say we believe, which is God's a loving God and our Father, He wouldn't want to bring us harm. So therefore, why would we not take help? And then I went into the story about for another time, but it was a good story and everyone liked it.
Yeah, I think that what struck me Luci, when you were talking, everybody, when you said you didn't want to get it at first, everybody, I was watching the board and everybody was kind of like looking. And as soon as you talked about the responsibility to your community and responsible to your elders and the people that are at high risk, every head on this Zoom nodded. Everybody nodded their head and went like, that is really the discussion. Because I think that, when Kekoa had talked about the term vaccine hesitancy or what, there are people that have all the information. They just don't feel like they're just making a decision not to. And then there's access too. There's both those issues, but there are the people that are out there, Pacific Islanders, that feel like I don't want to get this. And it just struck me when I saw every head on the Zoom nod when it said your responsibility to the community, your responsibility to your elders and people who have comorbidities. That's really, to me, the point that gets as we go through these and we go through the different regional teams and we talk to different groups, it seems like that's really a common thread that goes through. It's the responsibility to the community or to other people, not just yourself. So if you didn't believe in it, maybe it's the responsibility, a bigger responsibility, because we're all one people. So I thought that was really a great point that you brought up. Sorry, Naki.
Oh, no, you're fine. You're fine. Ruth, what have you been finding when doing your work? Are you finding that educating is making our community come out to get vaccinated, or is it just, I don't know, lots of questions? Because I'm seeing that when the vaccine first came out, we were like, ugh, and now that as time is going, we're getting more educated, and people like yourself, Ruthie, Kekoa, Luci, and Tino, we're starting to talk to our community, and everybody's like, okay, well, Tino said, or Kekoa said. Are you finding it's getting better?
From my experience, I'm the one that they're referring them to me. There are people asking for the appointment. So it is, we do got a lot more educating to do, but having leaders, in this example for like the regional PI task force, having them leading us, like if you just say their name, they're like, oh, okay. It's building that rapport, the trust in the community and our community leaders. And because of that, like we're having a lot of elders are like calling us like, is there any spots open? I rarely had any folks who were hesitant or folks who wanted to know more information. If we did, we would, again, like Kekoa has that information. Then we also have like other sites that we'll direct them to. If they don't understand it, we'll try to explain it to the best that we can. But other than that, I haven't had any issues with it. But being able to just, if anyone had questions, I would just explain to my best ability. But if anything, I always go back to Kekoa and he'll help me out with that.
Right. And I love that. Well, we always talk about when the pandemic started, COVID-19 first came out, we always talk about how proud we are that the Pacific Islander community everywhere got together, we rushed to help our own people because, right, who's going to help us if we don't do it ourselves? So I love that, the numbers got disaggregated right away. We split up into this Northern California and Southern California and just broke up and started helping each other get through this. Are you finding that people are still needing resources besides the vaccine? I know that SCDC is walking around, knocking on people's doors, handing them food. Are we finding that's getting better, or we're still needing the resources, needing people to donate food or whatever that our community needs?
I think, yeah, to your point, just supporting the efforts, just with the information, just to piggyback off what Ruth and Kekoa and Luci said too. It's just like, those care packages, those are one of the greatest things that we can give to, but also to the information that's in it. So we're putting a lot of COVID information, a lot of vaccine information to go out to the families that we're serving in our community, and just continue to make sure that they're informed. I know there's a lot of stuff that changes throughout, as like, DPA, CDC, and the state and the federal, everything's changing like, rapidly. It's something today and it'll be different tomorrow. So that's what we're dealing with some of our community members, is asking those questions and making sure that, yes, this is an answer today, but we don't know what the answer is moving forward in the future, because everything is rapidly changing and we got to evolve as all this data and information is coming out from the CDC and DPH and the state and federal. So, I mean, it's just one of those things too, is just continue to support, like you said, door to door. Even though it's high risk, like I said, we have a COVID team and making sure that they have the right PPE just to go out and serve our community. And not just our community, we're serving like, our African-American brothers and sisters, our Latinx community, our Asian community. So that's the bigger thing that we're seeing too, is just the great partnership, not just in our Sunnydale neighborhood, but trying to make sure it kind of pours into like all the other neighborhoods that our Pacific Islander families live in. So we can have the same process that we do here in these other neighborhoods, and that ensuring that our PI folks are being served too. and also to support it during these hard times. And like you said, it's just a lot of partnership, but just coming together with great folks on this call, just continue to share out the information that we all are doing in our different counties. And this is great to know, and also to what they're doing in Southern California. Just trying to piggyback off of some of the ideas, but also to enhance some of the stuff that we're doing here, how we can make it a little better. So I think, like, just even for the vaccinations rollout, it was a little trial and error, trying to figure out what worked, what didn't, what was the process, what was the flow, and also too is just making sure, like, our folks are being supported, but also too, just going back to the question, I think one of the questions for the vaccinations is the access. A lot of our people now are learning they want to get it, but they just don't know where to get it. And everybody's going to go to Walgreens. So everybody knows Walgreens and how easy and accessible that is. But then compared to all these other sites that are not accessible as for some of our elders or 65 and over that are disabled and have some underlying health conditions too. So I think just making sure that, we send our folks to the right vaccination sites and making sure that they're supported, but also not getting turned away.
Tino, you bring up a really good point about our elders. And I remember when the staff from SCDC was going out and handing out food, and I talked to one of your coworkers, and she had said she had gone to a door where an elder answered the door and asked if they wanted food, and they said, they don't need the box of food, but they just wanted her to stop and talk, like they just wanted, some kind of contact. And she did. She hung out and she, had a conversation. Hadn't talked to. She knew the elder, but hadn't talked to her in a long time. How are we reaching out specifically to our elder population? Because it could be the population that has a language barrier. It could be the population that most mistrusts the system. It could be, what I mean? Like, so a lot of things that our senior population could be more, all the things that are piled on, not knowing access and all those kind of things are going to be amplified by mistrust of the system or language issues. How are you reaching out and making sure that you're reaching the elders? And this is something that I've asked each of the groups as we've gone through it, because healthcare for our elders is a huge issue. How do we reach them with the vaccine information, for example?
Yeah, no, good question. And like I said too, like so we actually do deliveries to over 100 100 households that have our elders in it. I know our households are intergenerational, so we're hitting the whole family as a unit, grandparents, mom and dad, and the kids, maybe even the grandkids, great grandkids. But that's one of the ways we're doing it too. We actually do a delivery every Tuesday that goes out to over 100 of our elders that are on our list, that we share. We drop off the groceries and then the supply and the PPE, plus all the translated information too within it. We have two of our our senior program coordinators and a family case manager, which is also Eva Fakaui and then Fa'amalu Sione. So they're the ones leading the efforts to make sure that our senior and elder population is being supported, and also to making sure that they're getting the necessary needs and any other support that they need during this time. And also too, with the help of our director of programs, John Enna, that actually checks in. So they do their check-ins weekly also too. So they have a list that from their program that they go to, and they make sure that they contact all the seniors throughout the week. Even I go out on some of the deliveries and just to check in, just to talk, because sometimes they were coming here for a senior program. Now they're just at home.
Right.
So it's like now we're trying to do other stuff like infuse some of our SWE, Samoan Wellness Initiative, but also too, I know also Eva and Fa'amalu are doing virtual Zoom activities on here.
That's awesome.
So just even trying to get our elders and our elders just supported, but also too, I know virtual and all the technology might be different for them. So we always trying to ask some of their grandkids or their kids to support them in it. And they do like yoga exercises, different type of exercises that are culturally appropriate for them, but also too, like they can't get out and run. So they're just,
Right.
doing maybe like yoga in the chair. They're doing some Siva, like, Siva for wellness, where they're just dancing and doing all the actions and stuff too. But I think just for just reaching out to our elders with doing the check-ins and also just the food deliveries. And like you said, Carl, some of them would just be like, I don't want to box. I got too much, but it's like, give it to a neighbor, give it to a friend. And like you said, and they just want to conversate because that's what they miss, that socialization too. When they were coming here, talking amongst each other. Now they're just, sometimes they're just at home with their families or the kids. So I think that's one of the efforts too, that we should continue to support that population and making sure, because they're our history. They know our past, and that's what we got to look forward to. We just got to learn from them and just continue to keep them strong and thriving too. So thank you for that question, Carl.
That's awesome. I think our concern too is it's been over a year, right? Mental health. We have, you guys have programs that are helping, we have clinicians that look like us. That is important, for all generations, because we're not always one to go seek help, right? But have you found that that's picked up in PIWI, Pacific Islander Wellness Initiative?
Yeah, we have people who are wanting to see our clinicians. That's why we would have our Talāmoa for Wellness, and then we kind of advertise for our clinicians, because it's still a stigma. People don't want to talk about their feelings. Then you see suicidal rates start to rise up in our community and stuff like that. So being here at PEV, that's the resource that we provide. But yeah, we do see people who are wanting and seeking our clinicians here.
That's awesome. I think as time goes on, because right, it's a year, like after a couple of months, they're like, I don't want to talk to nobody. But after 12 months of some people being in a home by themselves with no one to talk to, I think that reaching out to you guys and finding a space for them to talk is important, and congratulations on starting that. Kekoa, do you have some slides you want to throw in there? I know we have 20 minutes, but our conversation is going really good, so we might be talking about it for a while.
Yeah, I mean, we could start the
wanted to-
slideshow, or we could just continue talking. But yeah.
Luci, did you have something?
Yeah, I just wanted to, since you were bringing up about the elder population of the PI community, Talāmoa has Natuvai that it's a senior group, and before the pandemic they were meeting 3 Wednesdays out of the month, and then the pandemic hit, and of course this was the population that was deemed that most high risk, and so then they stopped. But of course, with the isolation, and the whole purpose of Natuvai was to bring a piece of the social event, like bring the seniors together, because back in the islands, the villages are so close to each other that even if they were staying at home, they would still be socializing with many other people. But here in America, they're at home. It's a multi-generational house. Kids are at school, the other adults are at work, and then there's grandma, grandpa, uncle, aunties just sitting at home, not really talking to anybody, can't really go anywhere because either can't drive, don't have a license. The public transportation in the Bay Area, or especially on the peninsula, isn't exactly user-friendly as far as for getting easy access to various places.
Right.
And it's confusing, but Talāmoa had saw that and then started Natuvai, but then the pandemic occurred, and then Talāmoa joined the 21st century and started having Zoom meetings with them. So it's on the first and third Wednesday of the month from 9:30 to 11. And it's not just an hour and a half of just like talking, but they check in with each other. They share what they've been up to, what's the update. They do a physical light exercise time for like what they would show back in the 80s, like on TV, like Jane Fonda, that kind of thing.
Yeah.
Exercise in a chair type of thing. And then they would also do part of that would be exercising mentally, being able to use their minds, so that way it's not sitting, not doing anything. And they would do this, so it's every first and third, and it's a Zoom meeting. You can find that information on our Facebook page, but this has allowed them to still have some socializing, to see others, and kind of feel hip, for lack of a better term, because they're doing a Zoom meeting, and it's not just those of us who are at work, that they have a Zoom meeting too. That's all their own. And Talāmoa has also been giving them food boxes with funding from Asian Pacific Fund. And so that has been a true blessing. But it's nice to see that they have joined, that we didn't forget about them. We left no man behind, kind of thing. And
That's
so,
awesome. That's
Thank you,
awesome.
Lucy, for centering that. Yeah, because I think, and Carl for asking that question, because I do think that like our kupuna, our elders in our PI population do get overlooked, especially with regards to like vaccine outreach and navigation. Like the whole thing is all electronic, and that's kind of not a system that's really friendly for the elderly. So yeah, I think it's just about having those touch points like Tino and Lucy brought up, those
Yeah.
direct like contact, socialization opportunities where they could ask questions with each other, as well as like through whatever program managers running the show. I think that's amazing. Another thing that I found kind of helpful with regards to like reaching out to more elders is having one person I signed up for an appointment to a vaccine, having them search in their networks and then send them to me because I helped them already, so that they trusted me, and then kind of we had that rapport in that way. And then so having these like trusted messengers to help send and direct people to me and Ruth here
Right.
has been really helpful for us reaching more elderly who we're not like necessarily reaching like the first time.
Yeah. And familiar face is huge, right? Just to familiarize themselves and so that they can trust is a great thing. Tino, you had something else?
Yes. Also, too, going back to our senior program or just our elder outreach. We have also too partnered with Tongans Talāmoa for the radio show. I know ours is Sano Mai, San Francisco, every last Tuesday of the month from 6 to 7 or 7 to 8. 7 p.m. to 8 p.m. last Tuesday of every month. And then that's how we're reaching some of our senior population also too, because that radio show is just strictly in Samoan, in the language of Samoan. So Samoan speaking, everything is Samoan speaking throughout the whole talk. So even for myself, just learning the language too, helping me out a little bit too.
Right.
I wouldn't speak so much on there, but just good
Yeah.
to hear, just our folks speak, because back home, that was one of the radio shows that was back home in Samoa that they would just listen to, and they would just talk, like, just talking on language, but also too, bringing it here to San Francisco and America is just powerful too. Thank you, Tongans for Talāmoa for Tongans. I know Lucy probably knows about that too.
Yeah.
And just sharing that message. That's another way that we're contacting our elder population, senior population, is with that type of platform to make them feel comfortable, where they don't not everything is spoken in English, but also everything is broken down. I mean, everything is spoken in Samoan, so that's powerful too. And I know for Lucy and the radio show for the Tongans, theirs is actually in their own native tongue too. So that's powerful for both of us, Samoans and Tongans as communities, just continue to share our language with everybody also too. So that was one of the other ones, how we're reaching our senior elder population. Thank you.
Yeah, that's awesome. I know Lea Fa said that during the radio, since the beginning of COVID, the pandemic, that they've been educating the community in their language. And I think that's important for us to reach, a lot of our elders that don't really, they may have broken English or don't understand completely. So I love that Talāmoa and SCDC has connected to reach more of our community, especially the elders, so they can understand weekly what's going on, because everything changes. So they get the information in language. So thank you, both of you, for both organizations for creating that space for not only our elders, but everyone too. I know I logged into when SCDC was on and listened to a little bit of Talāmoa, because some of the words are kind of similar. So I was like, I think I understand that. But I got to listen to the Samoan part, and I was surprised that I could actually understand. I can't jump in or anything, but I was like, oh, I understand. It's been a minute. So are you ready for those slides?
Boy, can I add something?
Yes, Ruthie.
For our elders also, because now in churches, favelas are talking about it. So that's another way. Then you have some elders sitting in the pews are like, did you get your vaccine? Did you get your vaccine? And not only that, if you live in a multi-generational home, like for example, I'll use my mom as an example. She was keen on not getting the vaccine, but her sister who also lived with us, she was like, well, I'm gonna get it. And then she goes, why? And she told her the reason why she's gonna get it. And then my mom kind of like changed her mind, that she heard the fave'au got it, or this person got it, they're doing fine. she was more scared that the fact that, because she has these underlying health conditions, so do I. And I told her, I'm getting it. It was recommended by my doctors and specialists. And when I told her, you know what, make a decision based on your research. Contact your doctor, whoever it is, ask your primary care, like, is it best for me? And 100% of the time, they're going to say yes. And they did tell her that. And so she based her decision on, well, I know this person, they got it, they're doing fine. So that's how we're getting a lot of our folks coming in, because they heard, oh, this person got it and they're even more sick than me. And so that's the way that, another way how we were able to reach out to our elders.
But I love that they're having that conversation, right? Like, who would have thought, you know, down the line, the elders would be having this conversation and they can openly discuss it and find out what's right, what's wrong. And, you know, I think if they see somebody else in their generation or someone else getting the vaccine, it'll push them more on that side than not to get it. So that's
we're actually finding it's more important for like those people who already got the vaccine to then educate others and share that wealth, rather than having like somebody who was COVID positive kind of scaring them into getting the vaccine. It's more important to have like somebody who's been vaccinated talk about it.
Yeah, I love that.
That's been a big thing in our community. Like in the beginning, Naki and I were talking to people, and when COVID first hit, we heard a ton, because once the data was disaggregated, it was clear, like it was hitting us hard. But we heard a ton of people that were like, do you know anybody? I don't know anybody that's got it. So it was working the same way against us in the beginning, where like you had to know somebody that got it or it wasn't real. And it's going to be the same way with the vaccination is, well, who do I know that got the vaccination? Oh, like you said, our spiritual leaders, our community leaders, our community activists and organizations. Then they start seeing it, and then it's the same thing that kind of worked against us in the beginning. But I was going to say, it's really refreshing to see like the Samoan community and the Tongan community, like to hear, oh, there's a program on Talāmoa for Tongans on Radio Tonga that's just in Samoan, but it's in an effort to educate our people and to reach a group, and to see the Pacific Islanders come together for, running programming and trying to reach those groups is a lot of the same thing that Naki and I said is just so inspirational to see people like all of us. Did we know a thing about epidemiology, in 2019? I mean, maybe, but not the way we do now, but we had to learn it. We had to be able to help our people. So we just dove in. And it's nice to see that kind of cross-posting or cross-messaging between primarily Tongan programming and primarily Samoa, the Samoan Community Development Center, working with Talāmoa for Tongans. So inspirational stuff. I just thought I'd jump in because that hit me as soon as Tino started talking about, listening to a program in Samoan, but on a Tongan radio station. That's cool stuff.
Right. And we have a comment from an anonymous attendee. I don't have a question, but I really appreciate to hear from all of you telling us what's going on in California in our PI community. We have a lot of PI in Alaska as well. We are working to vaccinate our PI community here. Thank you all. Do we have a team in Alaska?
I don't know.
I have to ask. I'll look around.
Yeah, maybe we could connect.
Yeah.
Maybe it's time to make one if there's not one.
Exactly. All right, here we go, Kekoa.
Yeah, so thank you for putting up the slide deck, Tavai. We just had a few short slides to go through to kind of end the show and hopefully leave the audience with some resources, more resources than before we started. Yeah, so I guess the first slide, we could just go to the next slide. Yeah, so I guess the one thing we kind of wanted to emphasize today is that, ever since the 15th, California is kind of opening up eligibility for the vaccine to people with underlying medical conditions or disabilities. So just, if you know anybody who has any of these conditions, they may now be newly eligible to receive the vaccine. So a lot of Pacific Islanders are unfortunately burdened with a lot of pre-existing conditions. So this is going to be a helpful way to get more of our like vulnerable PIs in to receive a vaccine if they were not eligible before by age or occupation. So we just wanted to kind of center this. Next slide, please.
Thank you, Keikoa. So this is for San Francisco County with our efforts through the Samoan Community Development Center and the partnership through Mercy Housing, Face SF, J&J, and then the Bayview Child Health Center, and also in partnership with SFDPH. I'm just driving through testing where we have it at 2055 Sunnydale Avenue, San Francisco, California, 94134, and that's the address to the Samoan Community Development Center, and that's every Wednesday from 10 a.m. to 2 p.m. and that's drive-through. So you don't even have to get out your car to get tested. We got a drive-through testing site for you guys, for our folks. So it's easy and accessible. And also too, our translated flyer in Samoan. So these are the different sites that we're serving throughout our Visitation Valley. 1099 Sunnydale Avenue. We also have vaccinations and COVID testing going on at the same time from 10 a.m. to 2 p.m. And that's with our COVID team. And then our Sunnydale Community Wellness Center in partnership with Mercy and J&J's. Also Tuesday and Thursday, and Wednesday for vaccines. Tuesday and Thursdays for testing from 10 a.m. to 2 p.m. And then also for Wednesdays for us at the Samoan Community Development Center, 10 a.m. to 2 p.m. And below that is another pre-COVID testing and vaccine. This is our registration form. I know it's a little small font on there, but we always have a QR code so you can register, so you don't have to stand in line too long. You can actually register from the QR code, and also too, that's just for the 94134 zip code, unfortunately, but we're still working with other different neighborhoods and communities to make sure that our folks in the PI, our PI folks in those communities are being supported, also to getting the vaccination testing and support that they need in those different neighborhoods throughout San Francisco. Again, San Francisco, we're located, our PI folks are citywide, so we also just serve a couple neighborhoods. We don't just serve a couple neighborhoods like all these other organizations. We actually serve citywide because our folks are throughout the city and in different districts in San Francisco. So that's why I want to make sure that they're supported too, even though they may be over there by the Golden Gate Bridge and Presidio. We still want to make sure that they're getting supported and the necessary needs for what they need for vaccine or COVID testing. Thank you.
Awesome.
Next slide.
Thanks, Tino.
Due to the time restriction, I offered this slide with the resources, but maybe if probably by the design, or we could post it on our Facebook pages so that way people have access to it. But it's pretty self-explanatory as to what there are available in San Mateo County.
Awesome. COVID-19 testing. Saturdays, and those are the days. I think I posted that flyer, but we'll repost it on all our social media. Also with the other flyer, San Mateo County resources for a vaccination program. And these are all free testing, all free.
Yes,
you don't have to pay, so that's awesome.
For sure.
Is there another slide?
Yeah, on the Alameda County side, similar to what was said before, there's free testing being led through PI-led efforts, all free. There's one being run through the San Lorenzo Community Church. And then also something that Ruth and I have been, a place we're navigating folks towards is the Fremont High School vaccine pod. So that's also something available in the Alameda County that we're directing people towards, both free.
Nice. Childcare, food is big on my list. Mm-hmm. I'll go there.
Yeah, so there's a lot of opportunities to reach us. I think the next slide is our contact page. Oh, sorry, there's one more free testing opportunity through the in San Jose through other partners in Santa Clara County. We didn't want to miss them.
Awesome.
And then lastly, the last slide is just our contact information. If anyone wants to actually reach out to us to be navigated to some supports that they need, please feel more than welcome to email us.
Yeah, take your camera out and take a picture of the slide real quick and get a hold of them if you need any resources. And I think that's it, right? Oh, wow, look,
Yeah, that's
an
it.
hour went by so fast.
Real quick,
Yeah,
Koviki Talk is brought to you by Pacific Islander Center of Primary Care Excellence, PICOPSI. We thank Pycopsy for providing the platform we're on today.
Yeah. The hour went quick. We want to thank you all for the great job you guys are doing in California, Northern California, everywhere in the Bay Area. Tino, Kekoa, Luci, and Ruthie, thank you so much for joining us this evening. We appreciate your time. Join us every Monday at Koviki Talk. We're here at 5 o'clock. We are on the PI COVID-19 response team page and Poly by Design. Thank you so much for your time and space. We appreciate you. And keep up the great work, guys.
Thanks, everybody.
Thanks for having us on.
Thank you. Appreciate it.
Good night. Thank you.
Good night, everybody.
Hi, Nia.
Hi, I wasn't able to get on, but I was listening through online. So I just want to come on and thank everyone for making it and all that kind of stuff. Really, that was such a great session. You know, I love the information and all that. So wow. Yeah, for some reason my Zoom didn't work, but you guys forced me to go on Facebook. So you know,
I seen you comment.
Yeah.
I seen you comment and I go, ooh, Christine, you didn't let her in.
Yeah, so I couldn't let in, so I have to go back in. I went on Facebook and because I really want to listen. So
Thank you. Sorry. Thank you.
thank you, Tino, Felise. Yeah. Yes. Yeah. Yeah. Bye.
Carl, can you stop the Facebook Live, please?
Trying.
Oh, awesome.
Oh my gosh.
Well, this is Nia.
Like jump on me by like.
It wouldn't let